interpreter for providers. I'm delighted to have Dr. Jeffrey Chen with me, which I call a dear friend of mine. Welcome, Jeffrey, to our show, and please introduce yourself in a nutshell, and we can do a deep dive.
Yeah, thanks for having me, AL. It's been a pleasure getting to know you over the last year. Just to give everyone an intro on myself. So my name is Jeff Chen. I'm currently based in the Bay Area in Mountain View, California. I've been here for the better part of the last 10 years where I went to medical school at UCSF. I had a brief stint in Boston for residency, but I've been out here practicing as an attending since. Currently, I am working at Mills Peninsula Hospital in Burlingame, California. We're right across the street from San Francisco International Airport, and we get tons of patients, obviously, who speak all kinds of languages as a result. And I've been helping advise No Barrier for the last year, and have recently taken on the role as head of medical affairs, and it's been really a pleasure to work together on this amazing product.
Yeah. I'm gonna share kind of a personal story. In 2023, I think we started to kind of run with this idea, thinking about it, and approaching different providers, different healthcare professionals on LinkedIn. And I remember my first kind of message to you, Jeffrey, and we went on a Zoom, and I kind of started to introduce the concept, and there was some click there, and we just knew that we want to work with you, we need to work with you, and I can share that it was a hell of a ride. We learn every day working together. That was my angle. Perfect. So I think it's kind of we want to touch on different topics, really about the four walls where you have the patient and the provider, and just touch on a different kind of cultural aspects there, sometimes language, sometimes beliefs, and any kind of things that related to communication, to trust. And Jeffrey, you come from the ER spectrum, kind of emergency medicine, and maybe you can share with us kind of the bits and bytes of what does it mean to be in the ER with kind of facing different cultural aspects or patients with different backgrounds.
Absolutely. So, Eyal, I still remember that LinkedIn message and our first times connecting. And I was so excited by this mission of No Barrier because it's such a big problem, right? We, both in the ER as well as outpatient clinics and anywhere really within the healthcare system, the United States is an increasingly diverse place, and San Francisco is particularly a melting pot. I remember as a medical student at UCSF and doing a lot of rotations at San Francisco General Hospital, now known as the Zuckerberg Chen General Hospital of San Francisco and Trauma Center. We really had such an incredibly diverse patient population where about a quarter of patients were primarily Spanish speaking. Wow. Maybe a quarter of patients were primarily Chinese speaking. A quarter of patients were primarily English speaking, and then maybe a quarter of patients were all other languages, Russian, Arabic, etc. And it was really during this time, during my formative years, that I realized there's such a big gap in terms of the care that's provided to patients who speak English really well, as well as those with LEP, right, what we call limited English proficiency. And so I remember I was particularly drawn to emergency care because you get to see everybody and everyone. You get to treat all kinds of conditions, from heart arrhythmias to respiratory failure to broken bones to trauma, deliver babies. And so I loved the come one, come all aspect of emergency medicine. How at San Francisco General Hospital, you could be in one room taking care of the CEO of a multi-billion-dollar tech company, and in the next room have a homeless immigrant who doesn't even speak English, who's coming to seek care, and to be able to care for that broad of a spectrum is really incredible. Now, the way I got to see No Barrier as such an important product is because as a medical student, it was always my job, as the least most valuable person on the team, to be able to sit on a phone, for 5 minutes, wade through phone menus. Welcome to X interpreter service. Please dial 1 for Spanish. please dial 2 for Chinese. Please dial 3. Oh, excuse me, I didn't hear what you said. Can you please try again? Welcome to Accent Interpreter, right? It was just such a mind-boggling, frustrating use of time, and that's why it always fell upon the medical students to get the interpreter on the line and then page the team once the interpreter was finally available to be able to communicate with our patients. And I thought, there has to be a better way.
Yeah, amazing. Going back, kind of the diversity, specifically in San Francisco or maybe even California, do you see any kind of specific properties or something around the different cultures that you see every day?
Yeah, I mean, when people come to San Francisco, they're coming to a world-renowned city where they might have some relatives, they might have some friends, and so you may know San Francisco is actually oftentimes somewhat divided into kind of ethnic neighborhoods. It's obviously increasingly more and more blended, but for example, Chinatown, it's one of the oldest Chinatowns in kind of the New World, and San Francisco Chinatown has been around since the 1800s, the 1840s during the gold rush, and to this day there's a hospital there called Chinese Hospital that I practiced at for a couple of years that provides care primarily to the Cantonese, Toisanese speaking population in the area. And in the SF Mission neighborhood where San Francisco General is located, there happens to be a pretty heavily Hispanic population that speaks Spanish only. And so, as people move across oceans, across continents to come here, they tend to find people who speak their own language, who know their own cultural customs. And as a result, different hospitals will be caring for different populations.
Yeah. Got you. Amazing. All right. So let's go back to the room where you have your provider and patient. Let's say like in other non-English language. So guide us through different experiences. When you need to have medical translator with you, remote, maybe in person. Is it bilingual? Provider, maybe a friend of yours, family member, like what are the different kind of setup that you probably you saw in the last years?
Yeah, so there's a number of different options. You bring up family members, and that's I think one of the more common options, especially in specific populations. I think it's pretty well known that a lot of folks within the Hispanic community. Their family members might have had a bad experience at some point in a hospital. So oftentimes, Spanish-speaking patients will come in with a family member who will serve as an interpreter, right? And they'll, this other family member, whether it's a child or grandchild or cousin or whoever, will be taking a day off of work, right, to be able to come in and accompany their family member into the ER, into the clinic, because they have a little bit of distrust in the health system to provide proper care. Right, I can imagine. I can remember. There was one attending that I worked with at San Francisco General who would look at a patient and their physical exam, right, rather than waiting for the interpreter to get online and everything, they would just point at their head and be like Dolor, point at their chest and be like Dolor, point at their belly, Dolor, Dolor, Dolor. Is there Dolor here? Is there Dolor there?
It's the get by, right? The get by
exactly,
solution.
Yeah, it's not optimal care, and so I think a lot of Spanish-speaking patients, and then obviously this applies to all cultures as well. They'll end up bringing in a family member to ensure that they have kind of linguistically and culturally competent care. So I'd say that's especially in California in this area where there happens to be a lot of Spanish-speaking patients. That's probably 20 to 40% of encounters, depending on exactly where you are. In addition to that, there are phone interpreters and iPad interpreters at big academic medical centers, right? Like at UCSF and in Boston, where I trained at Mass General Brigham. They were fantastic in-person interpreters as well. And it was actually, I made friends with a lot of them. They were really, really patient in teaching me Spanish. I decided to learn Spanish in my last year of medical school because I was so fed up with this whole process, and I thought, it's a good life skill to have anyway. And so there's those are options as well. They have their pluses, they have their minuses. And then increasingly, of course, AI is all the rage, and anywhere you open the news, and increasingly there's AI interpreters, such as No Barrier, which I'm really excited to be working with. Beyond that, there's kind of unofficial, non-sanctioned AI interpreters such as Google Translate, which are, obviously amazing products, but also not necessarily designed and regulated for use within healthcare settings where privacy laws are so strict.
Yeah, yeah, yeah. We talked with many providers. In the last 4 years, I would say medical translator is the go-to solution. And we've heard that I would say the gold standard here is to have an on-site interpreter, right? So, like, I'm sure that you are aware that there are pros and cons to that. So, what can you kind of guide, like, why on-site interpreter would be kind of a really, really good solution, or maybe sometimes there are some drawbacks here?
Yeah, so I mean, obviously, in-person interpreters are, they're the gold standard, right? Humans, even with how amazing AI is, even with how amazing, video technology and audio technology can be, nothing replaces having a human interaction. And in addition, right, like an in-person interpreter is able to read the room, kind of feel the tension, read body language, really be able to understand things a lot better that might be lost over the airwaves. Now, of course, they're not always available, and even in the current ERs I work with, which are pretty big, they're not frequently used, right? Because they're expensive, and beyond that, what I have seen in the past is sometimes, a certain language's community is actually quite small. And so a patient coming in with a very private medical issue, maybe related to their own previous drug use or sexual health history, they would be very shy to speak with someone that could possibly know someone within their community. And so those are some of the drawbacks. And to be able to have someone available Saturday at 3 a.m. In the ER when someone comes in after a big car crash, right? Like that's not always feasible.
Yeah, yeah, yeah. And when we compare to remote, let's say, phone interpreters, I would say some of the cons are the pros here. Why there is anonymous phone call in a way, right? Or do you
Right.
see any advantage or disadvantage on audio phone calls?
Yeah, I mean, so audio only, and even with a video over an iPad, for example, right? There's pluses and minuses. I think it's for the most part accurate, but there will be a lot of stuff lost in translation, right? Sometimes I remember before I learned to speak Spanish, right? I would hear patients speak for 2 minutes straight, and then suddenly the interpreter would just say, "Oh, my chest hurts," right? And you're like, something got lost in translation there, right? Like, me duele el pecho y se mueve al brazo y también me falta el aire, and then they're going and going and going, and then all the interpreter says after 2 minutes is like, "My chest hurts." You're like, something got lost. So humans are not infallible, right? And then beyond that, right, there's still the time aspect, and even though not very few places use those touch tone menus like we used to, right? And oftentimes there's an iPad that you can just press Spanish or Chinese on. There's still a delay, right? You need to wheel around this iPad around the emergency department, and let's say you've got a Chinese speaking patient in room 5, and then all the way in room 23 you've got a Spanish speaking patient, and then literally we're paging overhead, "Hey, can someone please bring the iPad interpreter cart from room 5 to room 23?" And that cuts off room 5's time with the interpreter, and then the patient in room 23. The providers and the nurses, they're a little frustrated having to walk back and forth between just to move this piece of equipment. And so certainly that can be an issue. And then obviously there's still the issue of access, right? Saturday at 3 a.m., even online, like this sometimes can be hard to find certain languages. So
Yeah. So basically, we assume that on-site interpreters, phone and iPad interpreters are kind of a certified, medical translators, where sometimes family members most likely are not. So this is another kind of advantage of a professional translation. But I totally agree on the other kind of the waiting time. Sometimes we know that there is audio quality disconnections of calls, so you need to do it all over again.
yeah.
Perfect. Wonder if you have like a miscommunication story that you either were part of, or something like that.
Too many, AL. I mean, there's so many that it's hard for me to select. One pretty funny one that I could think of though is it actually comes from myself. So even after having learned Spanish, um, I would frequently be in a patient's room as the nurse is going in and putting in an IV, right? And so even though I'd say my Spanish is pretty decent, there were still some certain words that get lost here and there. Um, and so uh, when a nurse is putting in IV, I used to think like, oh, like I would tell the patients in English, oh, you're gonna feel a little pinch, right? And then so I would tell the patients, oh, like te vas a sentir una pincha, right? Like, and I was saying this for like 2 years, and for those who speak Spanish, you must be cracking up right now because you know that pincha or pinche in certain areas of Latin America and in Spain could be a very derogatory word. And so I was just blindly going in and telling these patients like you're gonna feel a little expletive, right? Like really bad word. And then so most patients they're already like very surprised that me and my Chinese face can speak Spanish. And so oftentimes patients wouldn't say a word until one brave patient told me like, no, 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 you shouldn't say pincha. Pincha means bad word. You should be saying piquete instead, or piquetito. And so here I was for 2 years, saying like blindly a very bad word anytime a patient got an IV, and finally I've learned to say it correctly, right? Like te vas a sentir un piquetito. You're gonna feel a little pinch in your skin, a little sting, a little bug bite, as we put in this IV. So that's I feel a little bit bad, right? Because I want to provide the most linguistically competent care that I can, and I hope at the very least it made patients laugh a little as they're getting their IV. So hopefully that took away a bit of their pain. But always a learning experience, right? Constipado and estreñido, also two different words that are used for constipation, very very frequently mixed up. I think by a lot of folks who learn Spanish as a second language. This can certainly I think make a lot of Spanish speaking patients laugh as well.
Nice. Yeah, this is a good one. We heard kind of a different kind of stories about miscommunication, for example, in diagnosis. We heard something I think less funny of. There was an interpreter that they were telling a patient you have um, cancer in type 2 or stage 2, something like that, and it was interpreted like you have two cancers, like so
Oh my
so yeah.
goodness,
So
yeah.
but I think one of the family members kind of caught that. But we heard kind of many different stories about kind of sometimes it's kind of on the funny side. Sometimes it's lost in translation and could get to some misunderstandings. And I
Yeah,
think,
absolutely.
yeah, I think also the thing that you took on yourself to learn Spanish kind of really emphasize the your commitment to a kind of a new standard of care, for Spanish communities in that sense. So yeah, I wonder if you have other tips or kind of recommendations to other providers which may face this daily challenge.
Yeah, absolutely. And I I'm very passionate about this issue, as you can tell, and so that's why during my fourth year of medical school, most physicians trained in the U.S. know that fourth year of medical school is generally a little lighter, right? You get brutalized during your entire third year or whatever year you have clinical rotations, doing 80-hour weeks, 24-hour shifts every other day, super painful. But fourth year generally has a lot more elective time, and so I took a lot of this time to really dive deep into textbooks, start using Duolingo, watch a lot of YouTube and Netflix series in Spanish with different Chrome extensions to be able to pause and really study hard the language. Not everyone has that time, and so I wouldn't expect everyone to just be able to pick up three other different languages. I'm also very lucky that my ethnic background is Chinese, and so as a result, I'm able to speak Chinese, which is the second most common non-English language in the EDs that I work in. And so it's for me, it's been a product of luck and hard work to be able to communicate with these patients. But I don't speak Russian, I don't speak Arabic, I don't speak Turkish, right? I don't speak Tagalog. And so for these reasons, I still need an interpreter for these patients. And of course, it's oftentimes going to be easier to bust out my phone and use no barrier rather than run from room 23 back to room 5 to go grab that iPad, right? When I've got 5 other patients waiting to be seen, 30 in the waiting room. This nurse is trying to show me this EKG. That family is trying to reach me and flag me down. This patient is trying to get, this just, it's nonstop. And literally every second counts and makes a difference in the ER. And so for, the other doctors and nurses who are listening to this, I presume that you're also very interested in being able to communicate with our patients with limited English proficiency. And so I would encourage you to do the right thing for the patient, right? Like even if someone brings in a family member trying to interpret for them, at least offer a professional interpreter service, right? We're legally mandated to, and whether or not that's through an iPad or through something like No Barrier, try not to do the easy thing and just say the Lord, the Lord, the Lord, the Lord, right? And so that's number one. I think number two, like as we move forward and AI kind of takes over everything, don't be afraid to adopt new technologies such as AI interpreters. So obviously make sure that things are cleared with your hospital's IT departments and that you're compliant with everything. But obviously a big benefit of No Barrier is it's totally HIPAA compliant. And so be forward thinking, try to do the right thing for the patient. And then beyond that, and Eyal, you and I have talked about this before, right? Beyond just language, right? There's so many cultural details, right, that I think also make a big difference in patients' care. Some of you might have seen the movie The Farewell by starring Awkwafina, who's a young woman whose grandma gets diagnosed with stage 4 cancer, and it's definitely a thing in Chinese culture and in a few other cultures where really bad medical news. Oftentimes the family will try to guard the patient from knowing, and so in this movie, right, they somehow are able to celebrate an entire Chinese New Year party, right? I think they fake a wedding. They literally fake Awkwafina's wedding so that everyone has an excuse to go see grandma one last time without ever letting her know that she has stage 4 cancer. And she, at various points, they're trying to trick her into getting treatment for what they say is something else. I've literally seen that in my own family in Taiwan, where a lot of the doctors are calling me, right, as the doctor in the family to make a life or death medical decision without telling the patient what is going on with her or him. And whether or not that's right or wrong, I think it's important that everybody learns the cultural intricacies and the little idiosyncrasies as well that can come up, and hopefully the product down the line, right, we'll be creating little cultural guides that will help folks be able to understand the patient populations that they're working with more.
Yeah, yeah, amazing. You cover a couple of things that I wanna echo again. One is that specifically the emergency department comparing to outpatient clinic, the rhythm and the mindset is very kind of quick response, overload tasks, and like it's kind of every minute counts, like literally, like so. This is one thing, and basically the interpretation, or let's say you need the Spanish medical translator right now. Like how do you get it faster? So I totally get the sense. And the other topic that you raised on the cultural aspect, where it's kind of how to navigate to get the patient autonomy, right? To get them to
Hmm.
know what's going on, regardless to the background culture, maybe family member in the room that kind of can and influence um, the flow of the call, or maybe we've heard also about some bias that could come from medical interpretation also. So it really kind of, where do you where what's the background of each player in the room? I would say this is kind of a kind of a nice thing to consider, at least. You kind of mentioned the AI, so maybe kind of a last question for the podcast, or kind of maybe a vision or a future, like what gives you hope for the future in our field, in our context?
Yeah, I mean, I think increasingly, right, within medical school education, there's such a focus on providing care to an increasingly diverse population throughout the U.S. And so, I think new doctors, new nurses, people are very hyper aware of these issues, and they're gonna do the right thing, right? Because not just because we all say a Hippocratic oath, but because in our heart of hearts, we all want to do what's best for a patient. And so, with new technologies like No Barrier being able to really expedite that, I'm really optimistic that folks are going to be able to go to a healthcare setting, a clinic, a hospital, an emergency department, and be able to trust that their doctors and nurses are really able to understand them, to really be able to communicate with them and to explain to them what's going on, and help make decisions together on kind of next best steps in a patient's care. And so I'm really optimistic about the future, Yael. I really am.
Amazing. I'm true that. All right. So, Dr. Geoffrey Chen, again, always a pleasure to talk now on live on the podcast. So, thank you, and hope you had a great listening. Take care.